In the meantime, the call for a thorough review of the proposed amendment to the Tobacco Control Act 2015 has been intensified, with stakeholders advocating for stronger measures to protect public health. In a media briefing organized in Abuja by the Corporate Accountability and Public Participation Africa CAPPA and the Nigerian Tobacco Control Alliance NTCA, the group stressed the need to reject corporate offers from tobacco companies, warning that such proposals often undermine efforts to reduce health risks associated with tobacco products. Elizabeth Kasham reports.
CAPPA Executive Director Mr. Kimbode Oluwafemi and Senior Program Manager Policy and Research Zikora Ibe observed that NTCA 2015 titled House Bill HB 47 and HB 1151 will strengthen tobacco control in Nigeria, as they also reveal gaps that must be addressed.
Deliberately saying that the act is National Tobacco Control Act, and that any attempt to inject the word smoking into the title of the act will undermine its objective, because it is not just about smoking, it's about tobacco use.
Our recommendations and demands include, which we also delivered at the public hearing, they include that HB 47 should also speak about regulations to cover new and emerging tobacco products. Emerging products such as vapes, e-cigarettes, nicotine pouches, heat-not-burn devices, and smokeless tobacco, even what we call shisha, remain largely unregulated under the Principal Act, our current legislation as it is. These products have gained traction and are aggressively marketed to young persons and falsely advertised as safer alternatives.
Project Officer Nigeria Tobacco Control Alliance Mr. Chibukeno Kire and West African Sub-Regional Technical Resource Officer Tobacco Free Kits Mr. Michael Ulaniye seek imposition of stiffer penalties for violations of smoking regulations to protect vulnerable populations and uphold health priorities.
We follow the development of everything Nigeria have signed, and what FCTC talked about is multi-sectoral control of tobacco. So based on that, we are saying that the Ministry of Health is strengthened and Ministry of Health should take proper leadership in controlling tobacco in Nigeria.
When we talk about the ban on single stick sale, it goes to the root of accessibility for two main reasons. When you do not have access to single sticks, or rather when you have access to single sticks of cigarettes and all other tobacco products, you forfeit the opportunity to see the graphic health warning, because the graphic health warning is on the pack, it is not on the stick. And so when you begin to sell in single sticks, then you have lost the impact of the pictorial health warning, what you should be doing to educate people who want to start smoking. The second thing you would lose is that it then becomes easily accessible to children. So a young chap with 20 naira, 5 naira can then go and use his lunch money to experiment with a stick of cigarettes.
The organizations urge policymakers to carefully consider their recommendations to create a robust and enforceable law that serves the best interests of Nigerians. Elizabeth Kasham, ASO Television News.